Hello everyone and welcome to my official YouTube channel. I am Dr. Wynn Tran, a practicing rheumatologist at Wynn Medical Center, Los Angeles. In this video, I will talk about 6 basic steps if you are having COVID-19 or suspecting to have COVID-19. Well, the first step I like to tell you is to keep calm, because most, over 80% of COVID patients will recover by themselves. Currently, the estimated number of COVID-19 patients is about 6 to 24 times higher than the number of reported cases. Or we have approximately 40 million Americans having COVID-19. Or 1 out of 8 people around us have COVID-19. So what does it mean? It means COVID-19 is common, it's everywhere. Now, it also means if the disease continues at this rate, all of us, you, me, everyone will have COVID-19. We have a little better understanding about COVID-19 disease and about SARS-CoV-2 virus. Even though we do not have a vaccine yet or an effective antiviral medication, we do have learned a lot about this disease in the past 6 months. We have some drugs that could reduce the mortality rate or hospitalizations, and we have better testing capacity, we have better tracking and isolating people. You are not alone, even though you are isolated. Our society, your family, your friends, and your doctor are fighting this virus with you. So keep up your spirit, because if you are down or depressed or anxious, your immune system is weak. And we know that to fight COVID-19, we need a strong immune system. So step 2 is to check if you have these symptoms. According to CDC, these symptoms can appear 2 days or even 14 days after the exposure to a virus or someone having COVID-19. So what are the symptoms? Fever, chill, cough, shortness of breath or difficulty breathing, fatigue, muscle or body ache, headache, and this is something new loss of taste or smell. So something that you can smell or you can taste and that you cannot. Sore throat, congestion or runny nose, nausea, vomiting, and then diarrhea. In general, if you feel unwell or if you're concerned about COVID-19, call your doctor. Step 3 is go to COVID-19 testing. If you are in Los Angeles County, please go to covid19.lacounty.gov/testing. And I also include this link in this video. For an appointment, COVID-19 testing is quick and simple. You likely will go there by drive-through, and the healthcare worker will take a piece of sample from inside your nose, and they will notify your test results in 1 to 3 days. If you are in other counties in California or in other states, call your doctor to inquire about test locations. So go to step 4. Once you confirm that you have COVID-19, and if you don't have COVID-19, congratulations. Now, if you have COVID-19, call your doctor to have the advice and follow-up treatment plan. Now, the key thing is you should not take any medications to treat COVID-19 by yourself. Talk to your doctor about any medication that you want to treat or you heard about. Now, your doctor will check your symptom over the phone. I will ask your fever, your chill, your shortness of breath. Now, for mild symptom, that means you don't need to go to hospital. Your doctor will likely ask you to stay home and continue to monitor your symptom. You should have some over-the-counter medications. The most common one we call acetaminophen or Tylenol. Again, don't treat COVID-19 by yourself. but very likely that your doctor will ask you to take Tylenol if you have fever or you're feeling common cold. Now, depends on your situations that your doctor will give you different medications. In general, the sooner we can identify and treat symptoms, the better a patient can recover. Now, you can use a pulse oxygen meter, like the one I showed you in this picture. This is a little device that you can put on your fingertip to check your oxygen level in your blood. Usually, the normal level is 95 to 100%. Some people with chronic lung disease, they may have lower number, less than 90%. Call your doctor if this level is less than 90%, because that is something that worrisome. Now, step number 5. When to call 911? Well, you should call 911 if any of the symptoms worsening or you feel unwell. Now, if you have trouble with breathing, you feel very hard to breathe, you feel persistent pain or pressure in your chest. Now, you also feel new confusions, or your loved one, your family member, realize that you are confused, and they should call 911. Inability to wake or stay awake, and they have bluish lip or face, and they have low oxygen level by the meter I just told you, or anything that you feel unwell or concerning, call 911. So we talked about 5 steps already. Now the last step you should do is call your doctor to treat all the chronic disease you may have, such as high blood pressure, diabetes, high cholesterol, gout, arthritis, or any chronic condition that you have for years or months. Why? Because these conditions, we call chronic conditions, may make your immune system weaker. And we know that a weaker immune system cannot fight COVID-19. So check with your doctor. One more thing, make sure you have your blood work done. Make sure to check vitamin D level. Multiple studies have shown that low vitamin D level associated with poorer outcome in COVID-19 patients. In fact, we know that vitamin D plays such an important role in our immune system, also in bone health and in other systems. So talk to your doctor about vitamin D. You can also check out my YouTube video about vitamin D level and what kind of food to eat or supplement to make sure you have enough vitamin D level. Thank you for watching. This is Dr. Wynn Tran from Los Angeles.